everyone. I'm Narsis Daftarian. I'm MD and Master of Science candidate in Experimental Medicine, Faculty of Medicine Department at the University of British Columbia. I'm also a research assistant at the Arthritis Research Canada and the main coordinator of INTACT study. I'm really pleased to talk to you at this virtual meeting of BC Lupus Society Symposium 2022. And it is my privilege to talk about retinal toxicity and hydroxychloroquine therapy study, which is briefly called INTACT. I have no financial disclosure. Our main goal by performing this study at the University of British Columbia and mainly at the Arthritis Research Canada is that because your health and vision are both important to us. Therefore, our mission on this study is to keep both intact. I would like to have an overview on the topics we are going to cover on this talk. First, why is Plaquenil, by the generic name of hydroxychloroquine, so important for the well-being of lupus patients? I'm going to use these two names, Plaquenil or hydroxychloroquine, interchangeably during my talk. What are the INTACT study's main objectives and its enrollment criteria? What are the main questions the INTACT study is going to address? Then, what is the process of annual retinal screening exam? And then wrap up with a summary and discuss the advantages of participating in this study. First, what is Plaquenil and why is it so important? Plaquenil is one of the safest anti-rheumatic disease medications. It has minimal side effect profile and it is safe even to be prescribed during pregnancy. Plaquenil has immunomodulatory effects. In other words, it regulates and diminishes the overreacted immune responses in patients with autoimmune disease to the self-antigens. It decreases autoantibody production, which is one of the main reasons of problems in patients with lupus. Therefore, Plaquenil is a cornerstone therapy in patients with lupus. It prevents mortality through reduction of major organ damage by reducing the inflammation in many major organs such as kidneys, which cause nephritis, and also reduce and prevents emboli formation, which obstructs vessels and will cause organ damage, for example, in kidneys or in heart or in lungs. Therefore, prevents thromboembolic attacks. Plaquenil, therefore, is a lifelong therapy in patients with lupus. It has to be taken on a daily basis as a maintenance therapy. A large Canadian study showed that in patients who are on Plaquenil as a maintenance therapy and have already gone into remission because of these drug benefits, if they suddenly discontinue taking Plaquenil, there will be 2.5 times greater chance of lupus exacerbation or flare up in many symptoms and signs of this disease, such as molar rash, fatigue, fever, hair loss. These may appear again. However, there may be a 6 times greater chance of disease exacerbation in a vital organ, such as in kidneys, in heart, or in lungs. There may be appearance of pleural effusion, which means accumulation of fluid around the lungs due to inflammation and shortness of breath, or heart problems such as heart attacks or lupus nephritis. And unfortunately, the patient may end up in an emergency room or in an intensive care unit because appearance of these problems. Besides these many beneficial effects that plaquenil has, there is a risk of side effect, which is called plaquenil retinal toxicity. Although this side effect is rare, but using older ocular exam equipment, because there has been usually late diagnosis of this problem, it used to be considered very rare, as 1 in 1,000 of patients taking hydroxychloroquine. This problem appears in the retina. Here you appreciate two images of retina, which is called fundus photograph. Here is the image of right retina, and here is the image of left retina. Here you appreciate the optic nerve, which is called optic disc, and these red lines are normal retinal vessels coming out of optic nerve and distribute into retina. And here at the center, you appreciate the macula, which is responsible for accurate or precise vision. And this problem, which is called bullseye macular damage or bullseye maculopathy, appears here at the very center of macula. As you appreciate, there is a red circle and a yellow ring around it, which is called bullseye, because it looks like a target. This problem will cause patient to have decreased central vision, and then the patients may see like this. They may have a blurry vision at the center of their visual field, and it will cause permanent visual loss if it will be diagnosed at its very late stages. Therefore, the importance of early diagnosis is very prominent to be able to prevent this problem to happen. With new advanced imaging called optical coherence tomography or OCT, very early diagnosis is possible before any visual symptoms to happen. And because of this early diagnosis, the risk is estimated to be 3 to 10 times higher than previously has been thought. Therefore, you appreciate early diagnosis before any visual symptoms is very important and vital to prevent this problem. Because this problem happens due to accumulation of plaquenil in the body, usually appears after the first 5 years of plaquenil use. What we do not know about this problem is that how great is the risk and which patients are more susceptible, affected by this problem, and what are the main factors that increase the risk. How does plaquenil retinopathy progress as its natural course? Therefore, the main objectives of INTACT study will be first to determine the real risk of retinal toxicity at its earliest signs in OCT, and then to determine the risk factors for developing plaquenil retinal toxicity. For example, what dose of plaquenil for each unit of body weight will cause this problem, and how it will be different in patients with different body structures. For example, how it will be different in a patient who is tall and thin in comparison to a patient who is shorter and overweight. And what about the duration of use or the underlying renal or liver disease? Because plaquenil is metabolized naturally in the liver, and it is excreted through kidneys into urine. Therefore, the underlying problems in these two organs may affect the problem of this side effect and affect the patients by taking these hydroxychloroquine retinal toxicity. And what about use of other drugs at the same time, which may affect this risk? And then to understand how plaquenil retinal toxicity will progress if it will be diagnosed at its very early stages versus later stages, and how we can prevent this problem to progress, and how retinal toxicity will affect the quality of life of patients who are affected and become low vision by this problem. Okay, who is enrolled in INTACT study and what are the eligibility criteria? The adult patients with a diagnosis of lupus or rheumatoid arthritis who have taken plaquenil for at least 5 continuous years and who are residents of British Columbia and have consented to participate in INTACT study meet the criteria to be enrolled. The enrolled patients will be screened as per standard of care. As I mentioned, every patient has taken plaquenil for at least 5 years to be diagnosed before the visual symptoms of blurry vision to appear. They should be screened on a yearly basis as standard of care. In this study, the enrolled patients will be screened only by retina specialists using OCT retinal scan. And the collaborating retina specialists in an INTACT study will follow very strict standard of care of standard of operational procedures to detect and diagnose this problem at its very early symptoms, at its very early signs in OCT image. Therefore, the INTACT study has established a network of retinal specialists in every region of British Columbia, and the names of these retina specialists in each region are provided on the consent form we are going to send to our potential participants through mail, email, or our online website. The INTACT study process will be as adults with lupus or rheumatoid arthritis diagnosis in the British Columbia who have already taken plaquenil for at least 5 years and have permitted us to contact them. We will send consent forms to them, and after they will give us their consent, we will contact their healthcare providers as their rheumatologists or their general practitioners to send referrals for them to one of our retina specialists of INTACT network for performing annual screening, careful exams, and then take their OCT retinal image in their obviously in their region, and after the retina specialist will perform diagnosis as maybe normal or suspicious, or they may detect plaquenil retinal toxicity. These retina specialists will anonymize these OCT retinal images, means that they remove the identity of patients and then transfer these images through very secure cloud server to 3 experienced reviewers or the very experienced retina specialists at Eye Care Center at the Vancouver General Hospital. The process will be that two of these experienced retina specialists will separately review again their OCT images. And if there will be any discrepancy in their diagnosis, then the third gold standard, very experienced retinal specialist will review again, and therefore there will be very solid diagnosis of the normal or the plaquenil retinal toxicity. Then these final results will be sent back to the healthcare providers to make any decision on plaquenil dose adjustment or have the patients stop taking the drug. And then the patient will be followed up again for another 5 years, but this time in a shorter interval, closer than 1 year retina screening exam or retinal follow-up exams. And if the final result will be normal, again, the patient will be followed up again for another 5 years, and the final result will be sent back to the healthcare provider to make this follow-up for yearly screening exam for another 5 years. Here you appreciate an overview of our process of INTACT study. First, the enrolled patients will receive an INTACT study card, and we will be referred for standard of care screening exams and retinal OCT imaging by one of the retinal specialists of INTACT study network in their own region. And then these retinal OCT images will be anonymized and will be sent through secure cloud system, which is a server, to the 3 experienced retina specialists at Eye Care Center at Vancouver General Hospital for verification and make a solid diagnosis and detect very early signs of this toxicity on their OCT retinal images. And then the final exam results will be sent back to the healthcare provider, which are their rheumatologist or general practitioner or internist, for decision on any required plaquenil dose adjustment or stopping taking or having the patient to stop taking the drug, and then replace another drug for plaquenil, and then follow up the patient for another 5 years. Therefore, your participation is very vital or important for this study. If you have a diagnosis of lupus and taking plaquenil for at least 5 years, and you are resident of British Columbia, it means that you meet criteria of you are eligible to participate in this study. Therefore, we ask you to please contact us at Arthritis Research Canada for us to send you the consent form and the required information. Please contact us at this email address, which is intact.study@arthritisresearch.ca, or you may proactively ask your healthcare provider to refer you to one of our retina specialists network in your own region by giving you the INTACT study card and then enroll you in this study. Please consider participating in this study, which will benefit the health and vision of millions of people taking Plaquenil throughout the world. Thank you so much for your kind attention. I will be happy to answer your questions by sending me these questions or contact us at intact.study@arthritisresearch.ca. Thank you again. Take care and stay safe.